Welcome back. In this video, I'm going to review the use of topical medications in managing shoulder pain and treating rotator cuff problems. Now, just like the previous video on the oral medications, there are two categories of topical medications available. There are over-the-counter medicines and there are prescription medications. The over-the-counter medicines are things like Bengay or Aspercreme, Blue Emu. There's a bunch of them that I've seen in the grocery store. And it basically looks like a little tube of toothpaste. So you just squeeze out a certain amount of it and you rub it on. It gets absorbed through the skin, and then it can penetrate and help locally where you've applied the medication. Other things like Biofreeze are more of a menthol-based medication, which does have some pain relieving and anti-inflammatory properties, but it's not the same as like Aspercreme and Bengay. So you can use either one of those. What I have found in my experience with this is that those tend to cause very temporary relief of pain. So it may feel better after you put it on for a little while, but it doesn't last for very long. And then you have to decide if you are willing to put this on 3, 4, 5 times a day. Depending on what kind of clothing you're wearing and how much this stuff smells, you may or may not want to be doing that on a regular basis. Some of these have a very strong scent, and if you work in an office space or you're in a setting where you're around other people in close proximity, you may not want to smell like that all day long. This isn't exactly the same thing, but I think this is probably the best place to talk about this. There are people that recommend using things like essential oils or ointments that are made out of herbs. I actually have quite a few friends that are into that sort of thing, and they will tell me from time to time that they've gotten a lot of relief from these things. So I believe that they work, but the difficulty with all of those things is trying to figure out how much of it to use, because the concentration of these essential oils or herbal supplements is not necessarily uniform from one manufacturer to the next. And so you don't know necessarily how much to put on and how often. And so you have to do a little bit more research on your own in order to figure out how much of this to use. But so I do think that that's a reasonable option. The limitation that I have seen with the topical agents in general, whether you're talking about essential oils or something that you buy from the drugstore over the counter, or even with the prescription medications, is that they don't work great in the shoulder because there's so much muscle here, and most of the problem that we're dealing with is deep down inside the shoulder. And so applying something on the skin and expecting it to get absorbed an inch or two into the shoulder is probably unrealistic. Most of that medication, once it gets through the skin, is absorbed by that deltoid muscle, and then it gets carried away by the blood flow. And so it's probably not ever getting down there to the rotator cuff where we want it to be working. So I've not been overly impressed with the success rate of topicals in the shoulder. Now, I mentioned the over-the-counter stuff. The other option is prescriptions. Now, there's two flavors of prescriptions as well. One is just the straightforward anti-inflammatory. And probably the most common one that you'll see on the market is a Voltaren or diclofenac cream. And that's basically an anti-inflammatory that they've just modified and put into this cream that can be absorbed through the skin. So it's the same drug as if you were taking it in a pill form. It's just that you're applying it locally. That works strictly for inflammation and does have some pain relieving properties. The other option is to do what's called compounding. And with compounding, what is done is we actually take multiple different drugs and combine them, mix them together, and make them into a paste. And by applying this over the area, you can get the local effect of multiple different agents working at the same time. So that might include an anti-inflammatory. You can include something like lidocaine, which is a numbing medicine. You can include a muscle relaxer. Sometimes you even include something that helps with nerve pain. So you can combine multiple drugs into one cream and apply it over the area. That does have some significant benefit, but the compounding sometimes adds considerably to the cost. And so some of these creams can be quite expensive, over $100 for a tube of this stuff. Now, if it works, then it may be worth it to you, but as a trial, trying to figure out if it works, that may be an expensive investment when you aren't 100% sure it's going to work. So that's how topicals can be used in dealing with rotator cuff. Now, the other option or the other question is, where do you put it on? Because sometimes the pain is in different areas. Well, you can put it wherever it's hurting that particular day. So if the pain is up here in this trapezius muscle, you can just put the medication over that. If it's hurting more out here on the outer part of the shoulder, then putting it there can be helpful. If it's hurting more across the front of the shoulder, sometimes that's your biceps tendon getting irritated, then you can put it over the front of the shoulder. It is generally safe to use the topical medications in addition to the oral stuff, as long as you aren't going overboard. They do act in the same way, but the amount of the topical stuff that gets absorbed into your bloodstream is so much lower than what you get with the oral medicine that it's probably not much of a factor.